Imagine waking up one day and knowing with absolute certainty that you are dead. Not metaphorically, not depressed, literally dead. Your heart is not beating, your blood is not flowing. You are a corpse walking around in a rotting body. This is not a nightmare. This is a real medical condition called Cotard's delusion, also known as walking corpse syndrome. And the people who have it will look you in the eye and tell you they died weeks ago. Cotard's delusion is one of the rarest and most terrifying psychiatric disorders ever documented. Some claim their organs have stopped working. Others insist they can smell their own flesh rotting. The condition was first described in 1880 by French neurologist Jules Cotard. She eventually starved to death. So what causes your brain to believe you are dead? Scientists think it is a malfunction in the fusiform gyrus. This is the part of your brain responsible for facial recognition and emotional connection. When you look in the mirror, your brain is supposed to recognize your face and attach emotions to it. But in Cotard's patients, this system is broken. They see their reflection, but they feel nothing. No recognition, no emotion, just a stranger's face. And because the emotional response is gone, the brain tries to explain why. It concludes, I must be dead. Brain scans of Cotard's patients show activity patterns similar to people in vegetative states. Their brains are functioning, but the emotional centers are completely offline. It is like being conscious inside a corpse. In 2004, a Scottish man named David was in a motorcycle accident. After recovering, he became convinced he was dead. He told his family he had died in the crash and was now in hell. He moved to South Africa because, in his words, hell must be hot, so I should go where it is hot. Nothing could convince him otherwise. Another case involved a woman who showed up at a hospital claiming she was dead and needed to be taken to the morgue. When doctors tried to examine her, she became violent, screaming that they were desecrating a corpse. She believed her body was rotting and refused to bathe or eat. She would sit in graveyards for hours, waiting to be buried. In some cases, patients attempt suicide not to die, but to finish the job, because in their minds, they are already halfway gone. Cotard's delusion is usually a symptom of another condition, like severe depression, schizophrenia, or brain injury. Treating the underlying cause can sometimes reverse the delusion. Antidepressants, antipsychotics, and electroconvulsive therapy have all shown success. But recovery is not guaranteed. Some patients regain their sense of being alive after months of treatment. Others never fully recover. They live the rest of their lives convinced they are dead. Imagine trying to convince someone they are alive when every fiber of their being screams the opposite. It is not denial. It is not stubbornness. It is their reality. Here is the part that will keep you up at night. If Cotard's delusion proves that your brain can be 100% convinced of something that is objectively false, how do you know you are not experiencing a delusion right now? What if your sense of being alive is just another story your brain is telling you? What if the only difference between you and a Cotard's patient is which lie your brain chose to believe? You think you are alive because your brain says so. They think they are dead because their brain says so. So who is right? Subscribe to Fudge here before your brain changes its mind.